right, guys, it's Mental Health Monday with LSF Health Systems, and Dr. Christine Caulfield is in studio with us today, and we're talking about loneliness and isolation, and I don't mean the self-isolation that I put myself in on a kayak yesterday. I mean kind of like the bad kind, right?
Right.
Okay, so, recent reports indicate that 1 in 10 Americans feel lonely on a daily basis, right? So loneliness was even recently declared a public health emergency in Silicon Valley area. So what factors have contributed to that rise?
I tell you, really, being on social media and Zoom calls, things that don't allow you to have direct contact with others, that's really kind of cracking our system for relationships. So that's really contributing, even though you might be on a Zoom call, for example, and you're seeing people, it's not the same as human interaction in person. Other things that contribute are divorce, moving to a new location, retirement for seniors. All these things can really lead to some depression, and then that kind of spirals to some isolation, and we really do have a loneliness epidemic in this country.
Yeah, you can feel it, right? The whole social media thing, the disconnect. While you are more connected than ever before, you're also more disconnected than ever before, right?
Exactly. Such a dichotomy, but so true.
Yeah, it's really interesting. And Zoom calls, like the conversation that you and I are having right here, like the Zoom call, I can never go, oh, that's awesome, doctor, that's great.
That's right.
You can't do that.
No.
And there's an energy that's felt when you're in the same room.
Exactly.
Right. So research also suggests that certain demographic groups are more vulnerable to loneliness than others. So which groups are those? Which groups are more affected?
Well, we find that young people are more experiencing loneliness, and really it's post-pandemic issues because we were so isolated, especially our young people, during the pandemic, and they're feeling the after effects even now. Our seniors, our senior citizens are very prone to this, and also our first responders. People don't realize their schedules and their situations that they experience on a daily basis can often lead to isolation and loneliness.
Absolutely, and also just the stuff that they go through, like the average folk, like, well, I don't understand what a cop goes through on a day-to-day basis kind of thing. So it's like you're just kind of in your own bubble. And I would imagine with children, especially with the whole COVID situation, like, we're like pack creatures, right? We have to be around other people to really get what we need, right? And for kids especially. And so how you missed all that time of like learning how to hang out with other people, right?
Right, exactly. Especially during those critical developmental years of learning how to socialize and becoming friends.
Right, it's a
and
skill.
All those skills.
Yeah.
Yes.
You're not innately just like ready to go hang out and be a good communicator. You have to learn. So can you elaborate on the psychological impact of loneliness on first responders, right? So let's piggyback on that.
Yes, well, so our hometown heroes, right? Our first responders oftentimes have very difficult schedules, or they're called out in the middle of the night for an emergency. And so oftentimes their schedules don't coincide with the general public, so they miss socialization, going out to dinner with neighbors or friends.
Yeah, they can't go to that festival because they're working.
Exactly, and their family members also find that they feel isolated and lonely because they don't have their significant other to be able to do these social activities, and oftentimes the spouse is dealing with the children and feeling that they don't have the support they need, and so it really does impact our first responders more than people realize.
Right. Okay, so what are some tips or tricks that we can do to like alleviate some of the loneliness and isolation?
Yes, well, I can tell you that it's very important to find common goals, common interest with other people. So rather than scrolling on your emails and going on Facebook, for example, let's say you like to kayak like you do. Find a group in town that has those kinds of activities and join it.
Yeah, absolutely.
And instead of reaching out via Facebook, pick up the phone and call someone or ask them to join you for dinner so that you can have that social interaction.
You make me feel old school. This is like how it used to be, right? And how it should go back to. That's very cool.
Exactly.
Thank you so very much, Doctor, for joining us today. So where can I send some folks for some more information?
Absolutely. So you can contact us at our Access to Care line at LSF Health Systems, 1-877-229-9098, and we will connect you to community resources.
Excellent. Thank you so much, Doctor.
Yes.
I always love talking to you. Thank you.